come on here to explain who my weight management service is for. Now, I've had loads of inquiries, I've sent information leaflets out to everyone, but I kind of thought it'd be helpful to do a video for the people who haven't messaged me or who have messaged me and have had the information leaflet, but I've had lots of questions, and sometimes it's easier to just explain in person, and a video helps to get that message out to more people. So the main thing I wanted to get across is who is the weight management program for. Now, this is going to be an extended video. So if you're watching on TikTok, then the link to the YouTube video is going to be in the bio. If you're watching on Instagram, same rule applies. Just click the link in the bio and it'll take you into the extended version of the video, which is on YouTube, because I'm not very good at keeping these things succinct. I'm sorry. So the weight management service is for people who are obese. So people who have really struggled to manage their weight, often somebody who's yo-yo dieted and has had success with weight loss in the past, but has then struggled to maintain those results for a variety of reasons. And the most important thing to get across right now is that is not your fault. It's not through lack of motivation, it's not through lack of commitment, it's the way that we are designed. And I'll do further videos to explain that side of things. But ultimately, this isn't a program for people who want to lose a little bit of weight for their holiday or a little bit of weight for a party or a special event. It's for people who are clinically obese, who need something to help them to get their weight into a healthy range. So we're not setting targets of having a BMI of 20 and getting yourself down to where you were when you were in your teens or in your 20s. We are literally aiming to get you into a healthy body weight. So how do you know if you're obese or not? BMI is the first thing that we would use to decide if you're obese. So your BMI should be 30 or over. Now, those who are slightly lighter than that, so if your BMI is 27, but you have pre-existing conditions such as high blood pressure, diabetes, coronary heart disease, then we also consider that BMI of 27 or above has been suitable for treatment. Okay. Now, people who've got lower BMIs but want to come into the program for an individualized, bespoke weight management plan are still more than welcome to come and see me. So it is open to everyone, but from a treatment perspective, it's BMI of 27 or over with a pre-existing condition, or 30 or over without any other health conditions. So a BMI calculator is your best way to measure your BMI. So you just put in your weight and your height and you'll get a BMI result. So if your BMI is less than 27, then I would still suggest that if you're interested in weight management in general, continue to watch the videos that I'll be sharing, because there's going to be loads of helpful advice and useful information about weight management that goes against maybe what you've been told in the past. So it goes against what I've told people in the past. So, you know, I've been a healthcare professional since 2003, and I've given people, you know, the run-of-the-mill advice, which now over the course of the last 3 years when I've been studying obesity, my mindset on it has changed dramatically. So follow the videos, even if you're not somebody who's fitting into the categories for a treatment. Now, we all know that BMI isn't the only measurement for your health with regards to weight, because there's people who have got a high BMI who are perfectly healthy. We're thinking of athletes who have got a lot of muscle density, who will be weighing more for their height, but we know that they are lean. And so how do we distinguish between somebody who is heavy and healthy and heavy and possibly unhealthy? Because not everybody who's obese is necessarily unhealthy at their size, and I'll go into that in more detail. But the next thing we look at is your waist circumference, because you may well be somebody who is very active but knows that they are still carrying a few extra pounds, and maybe the distribution of their body weight means that they could still benefit from losing some of that extra weight. So for women who have a BMI of 30 or more, who have a waist circumference of 80 centimetres or more, are going to be at increased risk of some of the additional health negativities associated with obesity. And the reason for that is because when your waist is larger, all of your visceral fat is around your organs. So if you're somebody who is pear-shaped and you hold that weight, so you've got a BMI of 30, but you measure your waist and your waist is less than 80 centimetres, then actually we're not going to be too concerned about your other health risks, simply because you're carrying all the weight on your thighs and your hips. And because that's going to potentially cause problems with maybe your joints somewhere down the line, because obviously carrying that extra weight has a burden on your skeletal muscles, your skeletal system, it's not going to have so much of an impact on your organs, because where all of our main organs are is all around our middle. And so when it comes to things like coronary heart disease, diabetes, high blood pressure, some of the major nasties associated with obesity, that's going to be at a lower risk if your waist circumference is less than 80 centimetres. If your waist circumference is over 88 centimetres and you're a normal body weight, then that's not good news. So you can still be someone who is carrying a lower BMI, but if it's all around your middle, you kind of have that, stereotypical beer belly, for example, where somebody's got like thin arms, thin chest, thin legs, but a big belly. That person, even at a normal body weight or a normal BMI of 25, is still going to be at very high risk of complications associated with that extra weight. So for women, we're looking at waist circumference of 80 and over for increased risks, 88 and over very high risk. For men, we're looking at 94 centimetres carrying an increased risk of complications, and a waist circumference of 102 centimetres carrying a very high risk. So men who've got a waist circumference of 102 or more but still have a lower BMI of maybe 25, 26 are still at an increased risk of sort of comorbidities associated with obesity. Now, that tends to be more for, I've already mentioned, diabetes, blood pressure, coronary heart disease. What it doesn't account for is increased risk of cancers, because we do now know that the second biggest modifiable risk factor that contributes towards your cancer risk, second to smoking, is obesity. So when we're talking about modifiable risk factors, we're talking about things that we can change, things that we have control over. So something like your family history, you have no control over. If you've got a long line of cancer in your family, you can't change that. However, if you are a smoker and you are obese, then those are the two biggest modifiable causes of cancer risk. Okay, so we're looking at BMI. So to simplify it, just quickly, for those who are like, oh my god, my mind is blown, the two things we look at are your BMI. If you've got a BMI of 30, it doesn't necessarily mean bad news if you're carrying all the weight on your thighs and hips. But if you're carrying all the weight around your middle and you're a woman who's got a waist circumference of 80 or more, or a man who's got a waist circumference of 94 centimetres or more, then it's time to start thinking about what else you could be doing to, one, maintain your current body weight and not increase it any further, and two, look at healthier choices in life. So the sort of next avenue to talk about is, well, okay, I'm obese, I'm carrying most of my weight around my middle, so I know I'm at increased risk. You know, do I need to come and see you? Like, what should I be doing? Where do we go from here? I've tried diets before. This weight just seems to stick to me, or I lose it and then it comes back on. I am stuck. What do I do? Well, the first thing I would say is, let's quantify things. So we've established that your BMI is high. We've established that your waist circumference is larger than what is ideal. But where are the risks at the moment? So let's just say you're on the cusp. Your BMI is 30, your waist circumference is 80 to 88, okay? What's your blood pressure like? Have you been for any health checks? So if you've been for a blood pressure check at your surgery and your blood pressure is lovely and normal, brilliant. If you've been for blood tests at your surgery and you've been told that everything is fine, so when you're doing general blood tests from a primary care setting, so your general healthcare setting, generally they'll be checking for your diabetes status. So are you diabetic? Are you potentially pre-diabetic, which is that sort of warning stage? It's like our, you're overweight, you're coming towards obesity, let's try and manage things. You've got your pre-diabetic, where your blood sugars aren't really well controlled, but you're not diabetic yet. So if you were pre-diabetic, you'd be alerted to that, because they'd be wanting to check you more frequently. They'll be looking at your hormones. So is your thyroid hormone normal? Because we know that an underactive thyroid that's been left untreated can potentially cause obesity or at least weight gain. I need to be careful here, because quite often when people have been diagnosed with an underactive thyroid, they've been told, yeah, that's probably contributed to your weight gain. But we know that these types of hormone imbalances might cause between 2 to 4 kilograms of weight gain, not 2 to 4 stone of weight gain. And quite often when people have been told, oh yeah, that might be why you are overweight or obese, once that thyroid function has been normalised with medication, you are now living with a modified thyroid function, a normal thyroxine level in your bloodstream. So you can't be using that as a reason for not being able to lose weight once it's in a normal range. So you're having blood tests to check for these types of hormonal imbalances. If you're a man and you've gained weight, you would want to have your testosterone levels checked, because if you've got low testosterone, then you are going to have lower energy levels and you're potentially going to be more susceptible to weight gain. So if you're somebody who's there, you're on the cusp, you're like, oh, you know what, I'm not bothered about how I look. Being overweight doesn't affect my self-esteem, it's not affecting my quality of life, I'm happy. Do I need to lose weight right now? Then you want to go and get these health checks done. So blood pressure, blood tests, which will be looking at all of the measurements we use to sort of quantify your risk of diabetes, heart problems. The risks that we can't quantify as easily are things like, am I going to be putting a lot of pressure on my skeletal system, and in 10 years time am I going to have significant knee pain? Because let's face it, if you're obese in your 30s and then you start to get knee pain in your 40s, it's going to be a lot harder in your 40s with knee pain, hip pain, joint pain in general, to then go about losing the weight. So I'll talk about the exercise side of things later. So to bring it back to where we're at now, if you are obese, you've got that higher waist circumference, you are somebody who can come and see me to join in my weight management program. And what the weight management program is designed to do is, first of all, educate you about why your weight has yo-yoed over the years, why you found it hard to keep that weight off when you've lost it. Because let's face it, I mean, in the time that I've been working in general practice, the amount of men and women I've seen who tell me, yeah, lost 3 stone, 4 stone, 5 stone, regained it. You know, I don't know what to do anymore. There's a reason that happens, and it's not talked about enough. And in the further videos that I'll be doing, I'll be explaining why that is. So if you fall into the category of the higher BMI, so BMI over 30 plus the higher waist circumference, you're suitable to come into this weight management program. If you're not in that range, you can still book in to have a consultation with me about what you could be doing to manage your weight, and to talk in an individualized way about, you know, what's going on and what changes you can make to have sustained weight loss. But I'll be covering that in these videos anyway. So if you just stay tuned, you'll get the information without having to physically come and see me. But for those who are like, do you know what, I'm absolutely sick of it, I want to have a long-term solution to my weight management problem, then it's worthwhile coming to see me. I can send you the information leaflets so you can have a read through all about the program and what it costs and how long you'll be, you know, coming to see me for, and ultimately to speak to somebody who's very empathetic about the struggle with obesity. And the reason I'm so empathetic is because I've sat with people and I've spoken to people who have the most traumatic reasons for why their weight has gone on. And, you know, from bereavements to abuse to bullying, that after working in general practice for that period of time that I did, and from working as a pharmacist in community pharmacy for many years and speaking to people about their weight, I just realised that obesity isn't about just eating too much. That's the physics of it for sure. You know, ultimately it is calories in versus calorie out, and you need to create this deficit. But what our body does after we've lost weight is quite alarming. And I think once you get an understanding of why we feel so hungry after weight loss and struggle to maintain a lower calorie intake, once you start to understand the reasons behind that, you can start being a bit kinder to yourself to maintain that weight loss and to give yourself a break. What we know now is that 5% loss in body weight has a significant clinical impact on your health stats. So, you know, I want to help people get to whatever weight they want to get to. But from a healthcare perspective, if you can lose 5% of your body weight on your own without coming to see me, you will be doing yourself a massive favour for your health risks going forward. Okay, that's enough for video 1. I'll let you know when video 2 is out. See you soon.